We see ads all the time for magic creams and patches for pain relief. There are so many ways that claim to treat pain between pills, patches, injections, lotions. So how do we know what actually works? Dr. Rudy Gari from Florida Pain Relief Group joins us now to help us figure it all out. Dr. Gari, welcome back.
Thank you.
How do we know if these things really work?
Well, the best answer to that is to find out exactly what that is. You know, you hear it on the radio, you know, these cure-alls.
Yeah, call now.
Yeah, unfortunately, sometimes some of those are just kind of like a placebo effect. Mm-hmm. You know, it may be just aspirin could be in there. Is it going to help you? Yeah, it's going to help you. We can probably just give you just about any patch, and 1/3 of the patients are going to react positively. The problem is it doesn't last long.
Right.
What we have to do is, you know, you have to go see a real physician, somebody that went to medical school, studied anatomy and physiology, pharmacology, and it's going to establish a diagnosis in you. It's going to treat you as a patient. It's going to listen to what is wrong with you, actually perform a physical examination, laboratory examinations, radiology, find out what the problem is, make a determination on how that affects you, and then get a plan in place, whether it's a pill, a patch, an injection, whatever it may be, and target that area.
Well, let's talk about some of those options out there, because what would be the best way to alleviate pain? Would it be a pill? Would it be a patch, an injection, a cream? I mean, there's so many choices.
So the answer is it depends.
Yeah.
Right? So it depends on, number one, who the patient is. It depends on what the problem is. Sometimes we can eliminate pain with a simple injection. That's all you take, and your pain's gone. Other times, you know, that's not the best way, and we're going to try out some very low-level analgesics, maybe like a muscle relaxant. You know, you might be having spasms. We're going to determine the type of pain. So there are actually different types of pain. There is what's called neuropathic pain, which is a nerve pain, and there's something that's called nociceptive pain, which is more like a dull and achy pain. And the medication and the treatment depends on the type of pain that it is. It's coming from your nerves, your joints, some of the organs, and we have to target and the physician that's very keen to that type is going to give you much better results.
We've heard of those icy patches that you can buy at the pharmacy, and I'm wondering, do they work? There's hot patches, cold patches?
Well, they work to the extent that there was actually someone that won the Nobel Prize for that. It's called the gate theory. And what that does is that works about as good as so if you may recall when you were little and you put your finger on the stove, and boy, that really hurts. So what does mom do? Mom comes by and she rubs your finger, and the pain's better. Well, the reason why the pain's better is because what you feel is the rubbing sensation, and that blocks the pain sensation. So whether the ice packs, heat packs, you're going to feel the heat or the cold instead of the pain.
Right.
It does work. So does massage and a lot of different things.
It's a distraction more than anything.
Yeah, because, again, it's called the gate theory of pain.
Right.
So only a certain type of fiber can go to your brain for you to understand that, and then it'll block the other sensation.
Okay.
We actually have a procedure called spinal cord stimulation. And what that does is that people that are having severe low back pain shooting down the legs, have had 3 or 4 back operations, we can put these little tiny little electrodes so you feel a tingling sensation instead of this pain that you have. And you can control that and program it.
Oh, I'm sure a lot of people are happy to hear about that. Dr. Gari, thank you very much. Florida Pain Relief Group even schedules same-day appointments. Visit their website, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. We'll be right back with more Daytime, so don't go away.